This is a case presentation for Practicum 3. The client is client C. He is a male. His main diagnosis is Down syndrome. I'll go more into his diagnosis in a couple of slides. He's 19 years old. He is a freshman in college. He has been taking music therapy with Mainstay Music Therapy Services for 3 years now. He's friendly and welcoming, and he absolutely loves music. Every time music therapy sessions happen, he's at the door waiting. Um, he adores working with Mainstay Music Therapy and having music therapy sessions. His diagnosis and assessment: he does have Down syndrome. He also has been diagnosed with sleep apnea, congenital heart disease, and he does have hearing impairment. And the hearing impairment is the primary focus of music therapy. He is high functioning in his motor skills. He's also able to communicate in full sentences, but the articulation is difficult for him, partially because of the hearing impairment, partially because of the Down syndrome. He is unable to express abstract thoughts and emotions. He has a really difficult time recognizing emotions outside of pictures. So if you were to put a picture in front of him of a sad face, he could recognize that that is sad. But if you described a sad situation, he would not be able to tell you that the person describing this was feeling sad. The abstract thoughts are difficult for him. His sensory processing is normal based on his assessment. He has wonderful social skills. He makes great eye contact, and he's able to do what you ask him to do. He can follow 1, 2, and 3-step directions. No problem at all. His cognitive skills are normal for his diagnosis, and he is able to maintain focus throughout a session. He's also very excited to try new and different things within sessions, and he oftentimes brings up different ideas that he wants to do. His goals are to increase communication skills, both goal 1 and goal 2. This was set by Mainstay Music Therapy, and we've been following this through the practicum. The objectives are a little different. The first objective would be given with one prompt. He's going to reduce the rate of speech within song phrases each session. So he really likes to talk quickly, and he has a lot of trouble articulating words because he's talking so fast and he mumbles. Given 2 prompts, he is going to engage in pitch matching exercises for 5 minutes in 95% of the sessions. So this is saying that for at least 5 minutes in every session, we do pitch matching through, and I'll talk about this in a minute, but we use chimes to match pitch and to recognize higher and lower sounds, and then we put that over to the objective 1 to reduce the rate of speech, but also to help with inflection in his voice so that he is putting a little bit of expression in his dialogue and communication with others. So some research on music therapy with this population as far as C's goals. Children respond to music quickly, and they can apply this to speech. This was a study done by Karen Lutke-Smith, and it was in the Down syndrome news. She was doing an article about why music therapy for people with Down syndrome, and she expressed that music therapy can allow people with Down syndrome to slow down their speech, to articulate better, to vocalize and to communicate at an easier rate. And through music, they've been successful. She's found that the children she's worked with have been very successful in communicating by using songs, by using pitch recognition exercises. There was also a study, a survey given out to caregivers, and these were caregivers of children with Down syndrome. And the caregivers were asked since your children have been doing music therapy, have you noticed a difference in communication? And the caregivers unanimously said that yes, the children that were using music therapy were able to communicate more effectively than before they started music therapy. So, again, there's more research that shows that music therapy with children with speech problems through Down syndrome or hearing impairments, when they use music therapy exercises, this one was filling in the blanks with songs and words being prompted. Um, the children were able to communicate better. Music training gives greater improvement over non music training in speech exercises. This was a study done by Hey Young in 2010, and it was actually with children with autism, but it was the same speech impairments and the same speech and hearing impairments as what client C has. And the children that were using music training were able to communicate at a better rate, and they had better inflection in their voices. So, a typical session with client C would be a hello song, and then a lot of time is spent with singing and song discussion, working on those abstract ideas. Um, and then a big chunk of it is using chimes to do a pitch recognition. So I would play a high pitch on a chime and then a low pitch, and we would talk about singing the first pitch and then sliding to the next pitch. Did you slide down or did you slide up? And recognizing where those pitches are, and then talking about how in our voices we would use different pitches. So if we ask a question, at the end, we would slide our voice up because we're asking a question. How are you today? Or uh, can you hand me that? So we slide our voice up. As opposed to when we finish a sentence, we slide our voices down. Um, I am good, and it's down. We don't inflect our voice either way. And that's a lot of what this client is working on, because his speech is very monotone. And so expressing emotion through his voice is difficult. So using the pitch recognition and pitch explanation and recognizing those pitches, he's able to communicate a little bit better when he's trying to put and express emotion in his communication and dialogue. So after we do the pitch recognition, we use an app on the iPad called Voice Star. It's karaoke, but it has a pitch recognizer, and so it follows along as he's singing and shows whether the pitch is correct or not correct. So this gives him practice immediately following the chimes and the recognition of the tones to put that into action and start really using inflection in his voice. So these are some uh, charts that I've been keeping, and it started in September and it's ending in November. The last time I was there was last Wednesday, and we're talking about higher tones and the percentage of times that he identified the correct tones. So if, as you can tell, red is incorrect and green is correct. Back in September, he got 80% right the first time, and then he dropped down to 40%, and he stayed at a great level of 80%. Now I asked him, we did 10 different tone recognitions for high and then 10 for low. So he's got 8 out of 10 right for 4 weeks in a row. This last week, though, he got 100%. So as you can see, his identifying the higher tones has stayed steady and it has gone up, which has been apparent also with his karaoke. His low tones have been a little bit different on the charts. They weren't quite as consistent. He started out very low. He only could recognize about 3 of the 10 that I asked him. But over the course of the semester, he's really bumped up his recognition of low notes. In fact, on October 29th, he got a perfect score. So he is starting to understand the finding the note and sliding to the next note and recognizing when to use a lower tone in his voice. In the future with Client C, I think that the continued use of the chimes have been helpful. I think that they would continue to be helpful. I think it would be great if we started to involve a slide whistle so that he could feel that movement more than just him singing. He could even see the elongation of the slide whistle when you drop the sound and you pull the slide out. Um, Client C is a freshman at a community college, and he is enjoying his classes. Uh, I, after speaking with his mother at a case meeting, she did say that he was going to continue classes at the community college. He also is a big public speaker for the Down syndrome community in northern Indiana, and he has had the opportunity to speak at many engagements, and he plans on doing more public speaking, and he's using the skills through the pitch recognition to be able to make his speech more interesting, more understandable, and more catching for the people to watch. There are some family goals that he is interested in. He does have a girlfriend right now, and so he's learning how to communicate with her and talk about things and use inflection in his voice and to increase his dialogue. His mom wants to have him stay active in sports, and she wants him to be able to really boost up the public speaking for advocacy for the Down syndrome community. So, as his lifestyle involves a lot of talking, he's even been on TV. Um, he gets to really use the skills that he's using in music therapy to advocate for who he is and for what he does and for the community that he lives in. So, through music therapy, he's been able to have the opportunities to public speak in an engaging way. I see a lot of um, potential in him, and I think that he's going to go really far um, with his speech practices and music therapy. These are the references for the cases that I explained under the slide of why music therapy. Thank you.